For the small and medium-sized stones of the urinary tract from the kidney up to the bladder, we can manage without making any cut or any incision by using ureterinoscope, which is shortened formally called as URS. The stones in the ureter can cause severe pain as called ureteric colic and cause severe symptoms and which can damage your kidney function or affect your kidney function. Also, this can cause infection and recurrent urinary tract infections. For these conditions, we can use the ureterinoscope and laser to remove the stones by breaking the stones using the laser, and also we can remove and relieve the obstruction. Failing to do so will make the patient go into sepsis and affect the kidney function. Few decades ago, all these conditions were treated by using open surgeries. But nowadays, with the novel technology of URS and laser, we can treat these patients as a day surgery patients without admitting, and patient can go home few hours after the procedure. This procedure is done without making any incision, and therefore patient can go back to his or her normal work the following day itself. Also, ureterinoscope can be used to relieve the congenital obstructions and the damage to the ureter following surgical conditions or after the accidental injury to the kidney or the ureter. Therefore, I would suggest going for ureterinoscopy and laser will enhance the treatment facilities which can be done at Asiri Central. It is freely available and we can do it as a day procedure. Thank you.